So I have here my actual desktop computer. We're going to be running Infirmary Integrated live during this recording. So I'm going to launch a shortcut from my installation of Infirmary. So here is what the first window that comes up after the splash screen closes is the patient editor, is what I like to call it. The patient editor is where you can edit patient parameters. So for example, we can edit vital signs, heart rate, blood pressure, respiratory rate, pulse ox, temperature. We can select cardiac rhythms. As you can see, there are many cardiac rhythms. I estimate last time I counted it was somewhere around 25 to 30. We can also select different respiratory rhythms, anything from agonal or apneic to Cheyne-Stokes and regular. This option here, use default vital sign ranges for rhythm selection. So some of the hidden features of Infirmary is that there are ways to streamline changes to multiple vital signs by using default vital sign ranges. So with this selected, when I change a cardiac rhythm, it's actually going to change all my vital signs. So for example, if I select asystole, it actually changes my heart rate, blood pressure, respiratory rate, pulse oximetry, and even the advanced hemodynamics to reflect that of somebody who is in asystole. And as you're likely aware, asystole is a fatal rhythm nearest to death. These vital signs reflect that. So I'm going to go back to sinus rhythm, and my vital signs return to the low end of the range, the default vital sign range for this cardiac rhythm, sinus rhythm. I have some expanders here. I can expand the advanced hemodynamics. I can set and title carbon dioxide, central venous pressure, arterial venous pressure, so that it does actually show separately from a cuff blood pressure. I can set cardiac output, pulmonary artery catheter placement for when we show various pulmonary artery pressures. I can select the actual pulmonary artery pressure that I want to show, intracranial pressure and intra-abdominal pressure. There's also a respiratory profile. So changing the inspiratory-expiratory ratio and mechanical ventilation status does change how respiratory rhythms are going to be put together, drawn, and displayed. The cardiac profile is a bit extensive as well. We can change the threshold at which a pacemaker will capture electrically and mechanically. We can enable pulsus paradoxus, pulsus alternans, and electrical alternans. We can alter the cardiac axis, which is especially useful when displaying cardiac axes on the 12-lead EKG. We can also set the QRS interval, also known as the QRS duration, and the corrected QT interval, also known as the QTC interval. These are set to normal parameters currently. We can also set ST segment elevation and T wave elevation, so we can mimic different types of heart attacks, acute coronary syndromes, and things of that nature. There is an obstetric profile, although the obstetric device simulators are not currently implemented. This version that we are working with right now is version 2.2.2. I do expect the obstetric fetal heart monitor and tachograph to be released by version 2.4. So I'll skip the obstetric profile at the moment, and we will make a future video for when that is released. Moving on, past the patient editor parameters. So these are all the parameters that we can set for our patient that we are going to simulate. Now, this patient that's being simulated, I'm going to open up a cardiac monitor now by clicking on the button that says cardiac monitor. I'm going to move it over to this half of my screen so that we can work with the patient editor and the cardiac monitor at the same time. So you'll notice that all the edits I made to the patient have not actually updated. This red line on the right side of the patient editor, that was covered by a scroll bar for a second, is because I did not click Apply Changes. So I have the option to reset all the changes that I made, apply the changes to the patient, the simulated patient that we are hypothetically working with, that is being digitally simulated. I also have the option to click this automatically apply parameter changes. If you want to make rapid fire changes to a patient who you already have your simulator set up and you're running a simulation and you want to make very fast changes, you can select this auto apply parameter change and it will, every single change you make to any of these numbers or values will automatically be applied to the patient model. We will go over that a little later. So this red bar on the right side of the patient editor indicates that the changes have not been applied. As soon as I hit apply changes, all the changes that I made to this editor will trickle down to the patient model. So I hit apply. Now the patient model is a digitally modeled patient. So one of the major features of Infirmary is that we're not just showing you on this cardiac monitor, this is not just showing you a facsimile or a copy of some pre-drawn QRS complexes and waveforms. This is actually creating real-time waveforms. So Infirmary has a patient digital model that is constantly going through the cardiac cycle and constantly going through the respiratory cycle. And so changes that we make are then reflected, any changes we make to that patient model are reflected to the devices that are quote unquote attached to that patient. So as I start to get a little bit more complicated and make some complex changes, you can see them in real time update here. Another thing you may notice is that there is some small amounts of fluctuation in the vital signs presented on the cardiac monitor. Every now and then this heart rate was reading 50. The pulse oximetry went from 93 to 92 and back to 93. This is actually simulating a 5% variance in noise, artifact, what we know as artifact in our monitors. So this cardiac monitor simulator is not just pasting the same exact numbers you put into the patient model, but it does introduce a level of complexity to actually simulate as if it's reading from a patient and receiving minor variances, not enough variance to introduce any changes to clinical realism or clinical determinations, but to kind of introduce that clinical realism that our devices sometimes get small amounts of artifact. So to explain that a little differently, this cardiac monitor is actually reading the amount of heartbeats that this digitally simulated patient is beating and reading from there. Much in the same way, it is making these waveforms from this actively running cardiac cycle of this patient model that is happening in the programming. So part of the reason that is important is because changes that are made to the patient reflect across all of the different devices. So I'm going to actually put this patient into a bit of a bradycardia. I'm going to put on auto apply settings. When I put on auto apply settings, this bar on the right turns yellow to let me know that I have settings that it will automatically apply. And as I start to click down on the heart rate, it's going to trickle down and slowly change the heart rate on the cardiac monitor. So alarms. We have alarms built into Infirmary Integrated, and so when a patient falls outside the default values for alarms, uh, Infirmary does alarm. So the setting for turning audio on and off is actually in the main patient editor. And now that I've turned the audio off, I'm going to actually re-enable the alarms to show you visually what they look like. So what you were hearing was the high priority alarm, similar to the triple beep that a lot of us inpatient nurses are familiar with. There is a way to edit using the scenario editor what the priority alarms are, how much of a priority those alarm noises come out to be, whether it's a triple beep, a double beep, or a single honk, and which parameters will reflect into the alarms. So I'm going to start to drop the blood pressure a little bit, just to kind of mimic, you know, what a sinus bradycardia might actually show. And so you can see the different alarm parameters are beeping, or well, they're have the audio off, but they are flashing. And if I turn the audio back on, you'll hear the different beeps again. The alarms back off. And now I want to move on to if we were actually going to treat this patient, thinking of what we might do for this patient. In emergency medicine, I know that if a patient is in sinus bradycardia with unstable signs and symptoms and end organ perfusion, we would likely use pharmacologic measures to increase, but I'm going to open up the defibrillator and we're going to actually work on some transcutaneous pacing. So the defibrillator simulator, sorry, that rhymes, but defibrillator simulator has a similar layout to the cardiac monitor. It's got the different vital signs and waveforms. And as you see, the waveform on the defibrillator on the bottom left of the screen match the waveforms on the cardiac monitor. We can add some different tracings, such as really any of the tracings, but to simulate a basic defibrillator, this one's actually modeled slightly after the Zoll, well, it actually the physiologic one, but it's a very generic defibrillator. Comes up with a EKG lead and a couple numbers. We can definitely add complexity to it, but we'll do that another time. What I'm going to do is I'm actually going to start the pacemaker. So the defibrillator does have the ability to defibrillate, and it also has the ability to pace. So as we mentioned earlier in the cardiac profile, there is a setting for pacemaker capture threshold. The default of 50 is just what we're going to leave it at. Now, as I mentioned earlier, these devices are showing an actual patient simulation. So as I put the pacer on, it's set to a rate of 80, and I start to increase the milliamperage energy that we're going to deliver, and I'm increased it past a certain threshold. We're going to start to see spikes, and we actually start to see the pacemaker capturing as well. So of course that initial spike would have been unfortunately an R on T. We do see that the pacemaker not only is delivering pacemaker spikes, it is capturing because we've passed the 50 milliamperage capture, and it is not only reflecting that on the defibrillator, but it's reflecting that on the cardiac monitor, as you can see. The pulsatile waveform, such as the pulse oximetry, also shows it is beating at a rate of 80 as well. So as you can see, if I click back to the cardiac monitor, essentially the EKG reading is measuring an 80 beats per minute, and so is the pulse ox measuring in at a heart rate of 80 because the patient's ventricular cycle is now running at 80 beats per minute. None of the other parameters have updated because if this were a simulation, of course, I would want you to have the freedom to adjust the parameters as you see fit. So a situation like this, you would want to be able to, respond if the patient were to actually be, for your simulation, responding to this pacing by having a stabilized blood pressure. We could just click up on the blood pressure a bit, and then suddenly it is reflected on the monitor, and similarly with the pulse ox as well. So that is one example of making rapid fire changes to the patient model with the auto apply parameters enabled and having it very rapidly show a patient improve or decline on the simulated devices. Last but not least, while I have this patient being actively paced, I'm going to open up the 12-lead EKG simulator. And now this is full screen. It does take a minute for the waveforms to populate and to draw, so it's almost like connecting a patient to the wires. It takes a second for those wires to start reading. This is a relatively messy waveform and a messy 12-lead EKG. I'm not going to pretend that this is the most realistic QRS morphology or ST morphology, but you can see that if I pause this device, this is showing the pacemaker spikes and the QRS complexes at 80 beats per minute that the defibrillator and the cardiac monitor were showing. And if you want to go to the color scheme on the top left and show grid, and then I can make the, oh, well, I guess the tracings are green. So the tracings on the grid can also be measured out so that if you did want to measure millivolts versus timing, we do have a grid to back up the 12-lead EKG as well. It's not exactly one-to-one. It's not calibrated perfectly. It's very much an estimate, but it is pretty well estimated. So I'm going to turn the grid back off. While we're there, I can show you there are different color schemes. And if I unpause the device, the different color schemes can show up and can be used in different ways depending on if you want to have a dark themed monitor or if you want to, for example, print these tracings out on paper. You could do a screenshot of the device as it is on a white background. So I'm going to pause and reload so that we can get a new situation, a new simulation running to show some more of the features of Infirmary.